Hey, social media, Dr. Joel Portnoy here from ENT and Allergy Associates. I wanted to talk to you about something that's really been very near and dear to my heart, especially over the past couple of weeks. I attended a lecture given today by Dr. Damir Hiramovich, who's a psychiatrist with Northwell here in New York, on the psychological impact of pandemics. The psychological impact? Well, yeah, we keep hearing about all these symptoms and side effects and statistics about death and disease, but what about how this affects all of us here? Before we get too far, I want to just get all on the same page. Let's discuss what is a pandemic. Well, a pandemic is basically an outbreak of disease that happens over a large population or over a large area. And the fact is that none of us alive today really know what it's like to deal with a true pandemic, because the last true global pandemic that affected the entire world was the Spanish flu in the early 1900s, and that killed about 100 million people. That's a lot of people. Coronavirus is not nearly as deadly, but is making a lot of people, even previously healthy people, very, very sick. So it's something we have to take very seriously, but we also have to understand the impact overall. So while it's really, really dangerous, we have to put those facts in perspective and think about how this whole disease affects us both personally and those around us. As healthcare providers, we are often focused on the medical aspects of the pandemic, which is where we really want to focus a lot of that attention. But there are also psychosocial aspects that we're not really paying attention to. We don't want those things to be forgotten. Whether patients have those disease or people around them don't have the disease, we still can be affected by the pandemic itself. So let's discuss how people feel during pandemics. They can feel fear, they can feel loss of control, uncertainty, despair and hopelessness, which gets worse during isolation, or they can feel even anxious because of all sorts of factors, including misinformation and lack of information. And these can all come together or be even in isolation and cause outright panic in otherwise calm individuals. What happens with panic is often people feel like they can't escape, that there's a high risk of being injured or killed, or that help will only be available to the very first people who seek it. So people run out and freak out. Such an example is why you can't get a roll of toilet paper frequently in your local supermarket. So keeping in mind that different populations and cultures have different ways of coping with this, I think that we have to make sure that we look for ways that we can help each other. So how can we help each other? The first way that I think is really helpful is to diminish loneliness. Just a simple call or a text or a video chat with someone that you care about may be the difference. Reach out on social media. We are living in an amazing time of technological advancement, one unprecedented in years before. So that comes as a double-edged sword in terms of information, but also it allows us to connect even though we may be apart. So schedule regular meetings with your friends or with a group that maybe you were meeting with before, or activities that cause you to feel engaged in your community. And especially reach out to those people that may be hurting in your community. Next, lean into your feelings. I love this sentiment. Acknowledge the fact that you're going to feel frustrated. You may feel sad. You may feel fearful. These things are all really normal. Personally, I have had the full gamut of feelings here, from hopelessness and feeling afraid to feeling hopeful and inspired. If you're feeling like you need support, reach out to somebody. There are lots of people that care about all of us. And if not, reach out to me and I'm more than happy to try to help support you. It's normal to feel that your symptoms may one day be at a top and the next day be at the low, and they may wax and wane, but I want you to realize that these are all really, really normal during stressful times like this. Also, acknowledge the fact that there are going to be economic hardships after this. This is something that we're going to feel the ramifications for months, maybe even years to come. Next, give praise, support, and encouragement whenever you can. Praise those acting socially responsible and encourage them to continue. Social isolation is really important. We talk about flattening the curve, keeping your distance, and really staying home if you don't have any reason to be out. Provide support and reasonable hope, especially for those people who have ill or deceased family members or friends. And encourage reaching out to charitable organizations or to your local community to help those people who may be less fortunate and may be needing you. Next, I think it's really important to identify those people at risk. Ensure that we identify these people who may be at risk because of lack of resources, lack of transportation. People can be very isolated in that situation, language barriers, or predisposing medical conditions that don't allow them to go out. Next, control the flow of information. We need to remind ourselves that we live in a 24-hour news cycle. And the truth is none of us have all the answers. This is a brand new phenomenon. So the information that we are getting, while it sounds all legitimate and a lot of it coming in at this time, it's constantly changing from day to day. What might have been true yesterday is not necessarily true today. And the media can really fuel this panic. So if you're feeling overwhelmed, turn off the news, turn off your phone, and meditate or find some other way that helps you relax so that you can feel like you're in control of your own emotions. Remember that panic is really the true pandemic. We will get through this. While it's likely that things may get worse before they get better, we as a people need to come together and be there for each other. I want to dedicate this post to all of my hardworking frontliners, my colleagues and friends, and yours, that risk their lives every day for our health and well-being. And also to those whose lives have already been claimed either by direct infection or by way of the psychological toll of its wake. You're not forgotten.